everybody. Welcome to this meeting of the SPA Complaints and Conduct Committee. My first meeting as chair. I know I've got big shoes to fill, so please be gentle with me. But very, very excited to have joined this committee as chair. Absolutely great to see everybody. I see there's a few people still joining, but I suggest that we just start running down the agenda. So obviously, agenda item 1 is welcome and apologies. I understand that I have got apologies from ACC Alan Spears. I don't believe there are any other apologies. And also just note that we're joined by Alan Wright and Maggie Pettigrew from HMICS. So welcome, good morning. Also, Debbie Riley joins us as well from Police Scotland. And I think other than that, we are the usual cast. I see Ilya has joined us from PERC as well, and I believe we also have Phil Chapman. Do we have Phil joining, who is the Director of Operations from PERC?
Yes, apologies. Phil will join us shortly.
Okay, well, no problem at all. So moving on to agenda item 1.3, which is all about declarations of interest and connections. Are there any of those to note in relation to today's agenda? No?
No.
Perfect. So 1.4 is in relation to any other business that is relevant to this committee. And I don't think there is anything to note at this stage. No, very good. And then I've got as 1.5, I've got the decision to take the business in private. So in accordance with the section 20 of the SPA standing orders, can I please invite members to agree to take agenda items 8 to 14 in private? Yep,
yes.
Good agreement for that. Perfect. Right, swiftly moving on to 2.1. So can I please invite the members to approve the draft minute of the August Complaints and Conduct Committee as an accurate record? Yeah, everybody's content with that. And 2.2, this is the public minute from the private meeting. And again, could I please invite members to approve the draft public minute from the private meeting from the August committee? Again, I've got agreement. Perfect. Moving on to 2.3, which is the actions log and matters arising. And I see that here we have got 6 actions that are proposed for closure and 4 actions that are proposed ongoing. Are there any comments from members on the action log at this stage? So are we content to close there? I see there's 2 actions that were raised at the last meeting, one in relation to realistic action due dates and one related to the committee work plan. So those, to me, I think are quite straightforward. There are 3 actions that are due for closure, which are relevant to agenda items further down the agenda. So we've got some reports. So I just suggest that maybe we take those items first, and then we close the actions as we cover off the substantive agenda items. Okay, so 2.4, I don't believe there have been any decisions taken since last meeting. So that's good. And that then leads us neatly into our first substantive item, which is the Police Scotland Professional Standards Quarterly Report. And I believe Chief Superintendent Katrina Henderson, that's over to you to initiate the discussion on this paper. Thank you.
Good morning, Chair. Good morning, members. I'm going to provide you a summary overview of some of the highlights from the performance report that we've submitted in advance of the meeting. So if I start off with the complaints, we've received in Q2 a total of 1,633 complaints were received. That's a notable decrease of 4.5% on Q2 of last year and a 0.7% reduction against the 5-year average. So therefore, broadly, that's comparable to the year-on-year stats. Year to date, compared to previous year to date, shows decreases in each of the command areas across the country, north, east and west, which is largely influenced in relation to a reduction of quality of service complaints as well as decreases in incivility and irregularity in procedure from last year. We've given proactive briefings into a number of divisions supported by analytical products to allow them to inform and deliver some proactivity in terms of their approach to standards. That, we believe, has hopefully assisted in helping towards a reduction. 3 of those divisions that we provided such briefings were Tayside, Fife and C3. In terms of frontline resolution, there was 593 complaints were frontline resolved during Q2. That is a decrease of 10.5%. However, we are monitoring that because that's the first time that that percentage has dipped below 40% over the past year. So we're not identifying that as a concerning trend at the moment, but we are undertaking to monitor that. Overall, decrease in complaints in the North Command. However, we have noticed that out with that trend, North East Division continues to record an increase of 3.3% against the previous year to date and 11.2% against the 5-year average. So again, we are monitoring that accordingly, and if need be, we will direct a more deeper and concentrated dive into the nature of that trend. In terms of East Command area, there's a slight increase in complaints in Fife against the 5-year average. That's an additional 10 complaints. C3 recorded a reduction of 25% against the previous year to date and 9.3% against the 5-year average, which is we believe is potentially representative of the additional measures and intervention that's been undertaken in terms of that supportive briefing and analytical product. C3 West Division is out of sync with the remainder, and it's been recording an increase year to date against the 5-year average. We are also continuing to monitor that trend as well. There was analytical work delivered to C3 West Division in June of this year, and there's been no further deterioration in the trend since then. But again, we're keeping that in focus. West Command area continues. Focus continues to remain in the divisions in respect of their 5-year average performance, although they are showing a decrease in the year-to-date performance 5-year average. Some of the divisions are showing a slight increase. In the main, that refers to quality of service matters. Chair, if you're content, I can move on following the complaints.
I think so, yeah. I think we'll probably just take we'll take your full reports and then I'll invite questions. Thank you.
Thank you. Moving on, in terms of the policing response to the death of Her Majesty the Queen in September of this year, we've recorded 9 complaints. These were all assessed as non-serious and 5 were concluded by frontline resolution. 4 do remain ongoing inquiries, but given the complexity and the scale of that policing operation, we viewed this as a positive. In terms of allegations, during Q2, we received 2,498 allegations. That's a 20.9% decrease on Q2 of the previous year, and there's also a 15.5% decrease in the 5-year average. These decreases have been observed across each of the command areas. Of the 2,361 closed allegations, 6.4% were upheld, which is a decrease of 2.5% from Q2 in the previous year. There are some low volume increases across a few of the categories. However, there's no apparent reason being identified for these decreases. And likewise, there's been no apparent pattern or trend assigned to the reduction in the number of allegations upheld. Statutory referrals, 99 statutory referrals were made to PERC during Q2. That's a 43.5% increase on previous year to date for Q2. The increase is largely in relation to armed policing. That's presentation of police firearms, where we proactively have used authorised firearms officers to bring high-risk matters to a safe conclusion for the public. There are no trends or patterns being identified that could cause a concern at this stage. Most have been in respect of spontaneous incidents that have been deemed disproportionately and justifiably dealt with by the police. 82 of the 99 were marked as no investigation following the referral that we placed into PERC. The other categories that have contributed to the rise in statutory referrals is serious injury in police custody, where a person's perhaps been struggling during a police arrest, or they've already had an injury prior to police contact, and also referrals in relation to death following police contact. In terms of assaults complaints are now automatically referred to PERC under Article 3. 81 such allegations of assault were referred to PERC, 11 of which were the subject of an investigation. 62 of the referrals await a decision as at the 20th of October this year. Complaint handling reviews, 51 complaint handling reviews were received by PERC during Q2. That's a 4.1% increase. They contain 237 allegations, and 68.4% were deemed to have been handled to a reasonable standard by PERC, which is an increase of 1% from Q2 in the previous year. Our Gateway, PSD Gateway unit received 634 referrals during Q2. That's a 16.5% increase. The specific increases were noted across matters of organisational risk, grievance-related matters, disclosure of information, controlled drug use and supply, and sexual misconduct. We've been putting in place extensive communications and proactive preventions messaging across a number of training courses, not least of all probationary training at the Scottish Police College. We can reasonably expect that following such input that we would expect to see an increase in referrals due to that subsequent raising in awareness. In terms of organisational learning, we discussed this quite thoroughly at the SPA workshop in October. We continue to promote a culture of organisational learning at PSD. The learning that we take from CHRs and other sources continues to be disseminated through our bulletins, individual feedback to officers concerned, and also used to inform training packages. We also have brought in an external organisation to review organisational learning as a subject in isolation across the organisation in its entirety. Once that review is concluded, we can provide a further update on measures or additional approaches that we intend putting in place to strengthen our organisational learning approach. We continue to front load any recommendations onto a bespoke platform called 4Action to allow us to track and monitor and manage progress as well as delivery of learning across the organisation. That would bring the summary of the performance paper to a conclusion, Chair. You may wish to ask Superintendent Riley to provide some highlights in respect of the conduct matters.
Absolutely. Before we do that, though, thank you very much, Katrina, for the paper and for the summary and the presentation. I think maybe before we go into the conduct, I see Katrina Stewart would like to come in. Katrina, please.
Thank you, Chair. I didn't mean to preempt what was coming next. I've just got a couple of wee questions, Katrina. Thank you very much. I think your report is very clear, actually, and I, really appreciate the kind of the what next kind of items, in response to the data. So that's really helpful. So it's just a couple of wee things. It would be reasonable if you're doing training that there would be an increase in awareness in terms of things like sexual misconduct. I appreciate that. So, but I'm just wondering, do you have a means by which you can actually confidently measure that in any way, just to ensure that that is what's happening, that it's a response to training, and confidence that any kind of reports of sexual misconduct will be taken seriously. And if it's okay, I'll just ask my other question as well, just to in terms of the complaint handling reviews, the actions on that, do you have timescales for following those up? Thank you.
Thank you. Yes, so in terms of your first question, Katrina, we do look at and assess the source of the referral that comes into the gateway. For example, we had a couple very recently that came in as a result of an input that myself, ACC Spears and Superintendent Riley did to 300 probationers. So we were able to quantify and identify that those reports came in as a direct follow-on to that input that we did, because those officers actually volunteered that information to us, so we were able to record that as such. In terms of your second question, the complaint handling reviews have a timeline that we need to respond back to PERC in terms of the recommendations. So we obviously work to try and meet those timelines, and PERC are constantly or continuously engaged with us to monitor and track the progress of those recommendations from the organisational side as well.
Thank you very much, Katrina and Katrina, for responding to the question. So I have got Fiona down as wanting to come in.
Okay, thanks, Chair. Thanks, Kat. That was really helpful, and I did find the seminar very helpful. So encouraging as well to see the way that you and your colleagues, are looking at things afresh and trying to strive for improvements. So a bit like Katrina, I've got 2 or 3 questions, which if I can give you them all at once. The question I have in my mind is how do we know that the proactive action that's been taken to reduce complaints is actually being effective? So it's that monitoring complaints over time. Would we expect to see, you're a big public service, you are always going to get complaints, there's no question about that. So, but for some in particular, would we be expected to see a reduction? So I think it's how do we know, how will we measure, and how will we know that the intervention you have put in has had the intended consequence? And I think that the other aspect is in terms of taking things forwards. Sorry, I've completely lost. I'll leave you to it, and I will come back if that's okay. So I have another point, but I will come back. Apologies.
Thank you, Fiona, for your question. So we're probably going to come on and speak about it in a bit more detail, but we have just launched a values campaign across the organisation, of which PSD have a key role and remit within that values campaign that sits in the Policing Together programme. So the PSD element of that is a preventions campaign round about the standards of professional behaviour. So as you allude to, we would expect, following some awareness raising, to see an increase due to that awareness raising, and also the fact we've hopefully imparted a confidence on the audience to report, and that their reports will be taken seriously, etc. So following that, and once we start to embed and change culture, which is the ethos behind the values campaign and the standards of professional behaviour preventions campaign, we would like to think that we do start to see a tail off in terms of volume, and we would be monitoring that accordingly. It's difficult to quantify how many are as a direct result of prevention. Very hard to measure prevention, as we all know. However, we do have measures in place for different parts of the programme that we seek feedback as well, that we will be able to hopefully embrace some feedback to improve what we do going forward, but we will also get input from people that have perhaps reported as a result of the educational messaging, etc.
No, that's really helpful. And if I may, Chair, my other question was where you do see complaints from the public or a nuance or a movement, and I know this will be complex, but is there any way of relating that to workforce numbers? So if staff feel they were short, are we seeing an increased number of complaints from the public about poor service? Or if there was an increased workload, are we seeing increased complaints from the public about irregularities in procedures or whatever? And I understand that that's maybe a big ask to see that correlation.
So at the moment, we're not seeing that. I think it's early days in terms of the resource alignment, however, and things may change going forward. So we would obviously look to do analytical product and analysis in certain areas if we start to see off-trend increases, particularly going ahead into times which could potentially be financially and resource challenging.
Okay, that's grand. Thanks, Kat. Thank you very much, Chair.
Thanks,
Thank-
Fiona.
Thank you. Paul, would you like to come in?
Yeah, I've got 2 or 3 questions to ask. The first couple are surrounding executive summary, and it's the bit about statutory referrals for firearms. So we see that Q2, there's 82 out of the 99 statutory referrals were marked as no investigation by PERC. And I'm not sure who'll be able to answer this. That means 17 are being investigated by PERC. And presumably that gets reported back in Elias. And my concern is that because we, obviously that will take time. We don't really see that in this performance report, in amongst everything else, in order to join up the various dots. And I wonder how we keep tabs on that and performance, rather than it being seen something as a perk thing, if you know what I mean. I don't know if I'm making much sense there. So that's my first comment or observation or question. The second one is the statement that the main driver for volumes of referrals are armed policing. It's 39 out of the 99 statutory referrals, and they refer the vast majority relate to presentations of firearms. Now, my question is, has there been a marked increase in incidents requiring firearms responses, and if so, why?
So, Elia, I don't know whether you want to, or you're in a position to respond to the first part of Paul's question from the PERC perspective about the 82 out of the 99 referrals.
I think it's probably best if Phil could address that when he joins us, when we speak
Okay.
about the referrals.
And it's just how we keep tabs in this performance report rather than it going into another one. Anyway, I'll keep for that for when Phil comes. So, but the firearms incidents, has there been a marked increase in firearms incidents? Well, there has been in incidents requiring the presentation of firearms, and if so, what's the case?
I don't want to surmise here, Paul, and I think I would probably take an action, but I do think that we are probably maturing as an organisation in terms of our strategies and how we respond, particularly with the increase in mental health and vulnerability reports that we're receiving. I do think that some of the reports that we're attending and the response that we might be undertaken maybe as a result of that. However, I would want to undertake probably a wee bit more detailed review of that and see if I can give you some wider reassurance.
Sorry, could you qualify that a bit? Because that sounds like if there's an incident with someone with a mental health issue, their gun is pulled, which doesn't strike me as what you're really aiming for.
No, not at all. My correlation there was quite often sometimes there might be an incident of a high level, high risk public order nature where we want to bring the public safely back to normality. So sometimes, it might be that a discrete armed response or something might be carried out to try and limit any impact, but actually deal with it matters safely and effectively.
Yeah, okay, thanks for that. The second question I've got is regarding the amount of time it takes for frontline resolution. And further down in the report, I'm trying to find in the timescales part, it makes the reference that 67% were closed within 56 days, the 56-day timescale, and the average closure time was 78 days. And my Grant is much more numerate than me, but my simple arithmetic means that it must take many of them beyond 60 days beyond their due date, which is almost twice as long. That third that isn't being closed within that timescale. Why does it take so long for frontline resolution? Because you would have thought this was quite a straightforward thing. That's the whole point of frontline resolution.
You're absolutely right, Paul, and I think I'll need to look into that in more detail with the local team just to understand some of the procedural aspects of that. If that's okay, I'm happy to take an action, and apologies that I can't.
It's about 4 or 5 months, between 4 and 5 months it's taking for a lot of these cases. And that's quite concerning for something that's supposed to nip the problem in the bud. and not let it sort of spiral out of control, so to speak.
Which we do, to be honest. So
Yeah.
I'm thinking it's a recording process, because the whole purpose, as you rightly say, is that it's a quick response that actually helps to de-escalate a complaint in a lot of instances. So I'm thinking it might be attributable to a recording approach, but I'll find out and
Okay.
can certainly come back to the board.
I think that's me just now. Thanks, Chair.
Thank you very much, Paul and Kat. Right, so Grant, would you like to come in?
Thanks, Chair. Some of the questions I had have already been asked and responded to. So there's one that I'm particularly keen on, Katrina, and thank you again for your very helpful summary of all the detail in the report, which is immense. Like most of us, we're very keen to see continuous improvement. And there's one area that I just wonder if there's any information about. Is there a record kept where the same sort of complaints coming in respect of any particular officer, which might lead to the need for particular one-to-one counselling or advice or something to try and actually stop this being a recurring problem?
Yes, there is. So we've got an early and effective intervention process, Grant, that we invoke where an individual officer becomes the subject of 4 complaints in a 12-month period. They'd be subject to intervention in terms of corrective advice, at the very least.
Right, thank you. Well, it would be very, very useful to have at some point some sort of summary about how many of these are arising in the course of a period, whether it be a year or longer, whichever is appropriate, really to test how that action is actually leading to a reduction going forward. I'm not expecting you to answer that just now, but it's very much a matter of it would help us to understand the effectiveness of that action.
Of course, we'll undertake to supply that detail.
Thank you very much. That's all from me, Chair. Thank you.
Thank you very much for that. Maybe just before we move on to the conduct matters with Superintendent Riley, just a few observations from me as well, because this is kind of the first time I've really gotten stuck into this report as well. And again, as you know, as colleagues have said, I certainly feel that there is a lot of really useful information in here. There is a lot of data, also still a fair bit of text. So I know that this, you know, I understand, obviously, after our excellent workshop that we had in October, I understand that you're continuously looking at how to improve reporting and presentation of data. So I think definitely something that would be well worth considering is just seeing how some of the narrative can actually be translated into graphs, possibly, and tables, etc. So it's a more visual presentation of the data. So that was kind of one of the observations I had. And I mean, another thing that kind of jumped out at me, again, with a relatively fresh pair of eyes, is the fact that the breakdown seems to be, so the way you break the down data is by the 3 command areas, which, again, from an accountability perspective, makes perfect sense. But I do wonder if there's maybe other lenses that can be overlaid on top of that, which I'm sure you do with some of your internal analysis, to see if there's maybe correlation against other characteristics across the 3 divisions. So maybe if there are certain teams, certain officers doing certain duties that incur a particular number of complaints. So it's about basically, rather than just saying, well, you know, the determining factor must be geography, actually looking at maybe some other factors and some other kind of ways to slice and dice the data and see if maybe that might give some sort of deeper insight. And another element as well, where I thought where it was really helpful within the report, that I think in some instances, for example, on page 6, you were making a reference to volumes of complaint per head of population, but that's, for example, not necessarily consistently used across maybe some of the other narratives. So again, maybe seeing if there are any metrics, you know, head of population, or maybe head of, or maybe complaints in relation to the size of the police force by sort of different areas, again, without kind of being solutionizing on this call. So that's just kind of my suggestion around the presentation of data. And another thing, apologies, just before we move on, chair's privilege and all that, now that, you know, I'm really getting stuck into this, is so I know that we have data on some of the officers that are being kind of, well, particularly within the conduct space, I think more so, but within the complaint space, I was wondering if we have data as to what type of officer is being complained about. And I know that there will be sort of the time and rank, there will be ranks, time and rank, there will be age. But I wonder if we have any diversity data that we can overlay on top of that. You know, for example, I'm thinking either maybe specific types of officers that are being more complained about than others, not necessarily from a, you know, is there something wrong perspective, but from a broader kind of really understanding the issue perspective. You know, because considering the relatively small percentage of complaints that are being upheld after the investigation, I do wonder what is the impact of the totality of the complaints on the workforce. So that's kind of a different angle there as well, just to really understand the full impact of complaints, not just on the public, but also on the workforce as well. Apologies, lots to consider in there. I just thought the report was fascinating, so
Absolutely, Chair. And one of the things that we are progressing and working on is there's probably, in respect of some of your asks, there's probably some slight limitations in terms of our database that we currently use. And in fact, it's been one of the matters highlighted as part of Lady Eilish's review. So we are actively looking to put out and bring in an upgrade into our PSD database that should actually help some of the recording of that diversity detail. And that is underway. However, at the moment, we are a bit more limited in terms of what we can supply. But I've noted your points and absolutely will speak to the team and see what other avenues we could perhaps report on.
Thank you so much for that. And can I just double check on the timelines for the introduction of this upgraded functionality? Do you have any idea as to when some of that improvement might land to enable you to interrogate?
Yes, I'm hoping that we will early next year. Procurement are engaging with relative organisations in terms of tendering, etc., for a system. So I couldn't commit to that just now, but work is underway.
Thank you. Thank you very much for that. Right, I think Superintendent Riley, it's over to you for the conduct part of the report.
Thank you, Chair. I appreciate that the conduct aspect will also be discussed at the closed board, and perhaps that's an opportunity to go into some of the detail at that point. But in terms of the overall conduct, members will have had the report submitted to them. What we have seen actually in the past quarter is a decrease in the number of assessments undertaken by the conduct unit. Having looked at it in detail, there's no particular trend or any significant reason that's highlighted there. What we are seeing, though, is divisions are more proactive at addressing conduct at a very early issue, and that's part of the work that Chief Superintendent Henderson had outlined at the outset. But we still are seeing a kind of steady flow of conduct assessments, and there's a chart there that illustrates how many we've had in terms of gross misconduct investigations year to date and previous year to date. During the period, there were 63% as misconduct improvement action or misconduct no action. And whilst on the face of it, that looks quite a significant figure, many of these relate to low-level road traffic matters, which in itself is about 41%. In terms of investigations, though, what I will say is whilst the assessments have went down, we have seen doubling in the number of investigations that we've decided to take on, and there's just one investigation in particular that has many officers as subject officers, which has caused that consequential increase. As I said, the outcomes that we've had this year, the report here says we've had 4 dismissals in the past quarter, but overall, this year we've had 6 dismissals, 1 demotion in rank, and you can see there were a number of final written warnings and written warnings issued as well. I'll move on, unless there's any questions, I'll move on to restrictions and suspensions, but again, I'm more than happy to take questions in the closed session to go into some of the details of these investigations if required. We are seeing I suppose notably there, we've got the number of officers who are suspended. It's a figure that will stand out to members, 46 compared to 28 this time last year. And having looked at trends, we have seen certainly particular cases of sexual misconduct where the officer will be suspended. And again, I will go into details in closed session if members are content with that at this time. We have seen a number of suspended officers and restricted officers resign or retire during the year to date. That's 14 in total, as outlined in the report. And again, when we talk about the misconduct meetings and hearings and officers resigning prior to them, that will be in the closed sessions, and we can discuss that again in detail. And there are figures there in relation to police staff suspended as well. I've kept that fairly succinct because you know, there are only 2 pages there, but appreciate that members may wish to ask questions, some of which I can answer, but certainly due to some sensitivities, I'll maybe go into detail at the closed session.
Of course. Thank you very much for that. Debbie, are there any questions at this stage? No? Okay. Thank you very much for that. Are there any final questions, observations from anybody just overall on this report? No? Perfect. Thank you for that. So which leads us to our next agenda item 4, which is the SPA quarterly report. And I believe that's being presented for discussion, and it's Darren, you will be kicking off the discussion on this item.
Thank you, Chair. Thank you, colleagues. Again, I'll take the report as read and highlight some key points. As you know, this is a regular SPA quarterly report that includes key statistics, in this instance reflecting the position at the end of Q2 with a comparison to the previous 7 quarters. In terms of some key statistics, we continue to see a consistent trend in both relevant complaint volumes as well as associated allegations. In respect of recognising that volumes remain low, the majority of those relevant complaints have related to senior officers. 79% of the allegations relate to on-duty complaints, with the remainder relating to sort of quality of service complaints. Early stage resolution, which is our equivalent essentially to frontline resolution that you heard discussed earlier on, continues to be an effective means of addressing complaints of a less serious nature. And over the period, 39% of allegations have been resolved in this way. We do continue to see improvements in our average time to close relevant complaints. And as noted in the report, only 3 over the period referred to, so the full 8 quarters were beyond the 40 working day or 56 calendar day target. The report also covers beyond the performance statistics, usually updates in terms of key meetings that we attend with partners. The National Complaint Handling Development Group hasn't met since the last meeting, so no update in that respect. And the Partition Strategic Oversight Group, that's the group that meets sort of separate to the DMAILish National Governance Reporting Arrangements, is actually due to meet tomorrow, so I'll provide update at our next meeting. Members will note reference in the report to an international research project. The committee participated in the early stages in terms of data gathering, and a plenary meeting took place recently, which was attended by a couple of members of the committee and officials. The research is still at an early stage, but it was positive to note that in terms of complaint arrangements within the UK, including Scotland, these are largely more mature than elsewhere, although it was noted around about opportunities within the UK around about measurement of complainant satisfaction that is in place in other countries. And members were noted scope potentially for a future presentation to the committee once the project develops further. The only other point I would note is activity undertaken in the last period, very specifically looking at organisational learning covering the period from 2018 to date, which we'll present as a separate item. So happy to take any questions.
Thank you very much, Darren, for the paper and for this presentation. May I invite any questions or observations from members on this item? Grant.
Thanks, Chair. Darren, thank you. That's a very clear presentation, and the use of graphics, I think, is extremely helpful. I appreciate that complaints against senior officers are very much because they're the figureheads of what's happening within the organisation, shall we say. Have you noticed any any particular trends coming through about these relating to speed of or lack of resolution at an earlier point, where someone is trying to make an allegation and felt that actually it wasn't being handled sufficiently successfully in their terms earlier in the experience, so they then repeated the complaint, heading towards the senior officer, perhaps on the basis that they're the ones who are overall responsible. Is there anything that you can sort of clarify or flush out, or anything to give us a bit more information about if that's a trend or whatever?
So thank you, Grant. Certainly in the last quarter, and to my knowledge, over the last couple of years that I've been involved in complaints, that's not a theme that we're seeing specifically. Certainly, where a complaint is made, and any consideration that that's not been handled appropriately by Police Scotland, then by and large that is something that if individuals are dissatisfied, then the right of recourse is through the PERC in terms of a complaint handling review, unless specifically there is a relevant complaint which is around the perceived action or inaction of the senior officer themselves. So no is the answer there, Grant. And certainly in broader terms, the report that we'll come on to shortly, where we have undertaken that broader analysis of themes, trends over the 5-year piece. Again, that's not something that's necessarily coming forward at all.
Right, thanks, Darren. That's very helpful and very reassuring. I just thought it was an area that was worth just inquiring into. Thank you.
Thank you very much, Grant and Darren, for this. Really helpful for me to understand as well. So I really appreciate that question. Okay, are there any other questions or observations on this item? No, in which case, thank you. We are moving on to agenda item 5, which is the PERC quarterly report on Police Scotland handling of complaints and investigation referrals. This item's up for discussion, and Ilya, I believe you are introducing this.
Yes, thank you. Good morning, committee. I'll perhaps speak to the report in relation to the complaint handling reviews and provide some update on Q2. I trust everybody had an opportunity to see the report. You'll see that in Q2, and in fact year to date, we're experiencing perhaps a slight reduction in the number of the applications received for complaint handling review. In Q3, that trend has now been reversed. In October, November, we're certainly seeing an increase in the applications. So we'll see where it'll take us towards the end of the year. But generally, it is very difficult to predict. I don't think there is any specific reason for increase and decrease in the number of the applications we received throughout the year. Certainly in the past, we've had some very busy end of financial year, receiving over 100 applications in 2 quarters. So we'll see where we are at the end of the year. But in Q2, we issued 51 CHR reports with 213 individual allegations reviewed. Slight increase in terms of the number of the reports issued. However, I think slight decrease in the number of the allegations reviewed simply means that the cases that we reviewed had a slightly lower number of the individual allegations within those reports. Generally speaking, this year we actually observe a quite significant increase in terms of the number of the allegations per CHR report. I think by the year end we might be somewhere close to 6 individual heads of complaint per CHR, which is a significant increase from 3.8 complaint allegations that we've seen in the previous years. But just going through the report, you'll see that in terms of the timescales for the provision of the papers, initial request for papers, that there has been an improvement in Q2 following our last meeting. The average was 8 days in Q2, and certainly in 87% of all requests, Police Scotland managed to provide the papers within 14 days. So that's something positive. Generally speaking, in terms of the information requested during the complaint handling review process, I think you'll see the figure remains relatively steady. 29 days on average that we're awaiting for the additional information during the CHR process. Thereafter, we presented a breakdown of the recommendations. You'll see that in quarter two, 66% of the complaints we reviewed were deemed to be handled to a reasonable standard, slight decrease from quarter one, which was rather exceptional, 79%. But year to date, I think we're still in the region of 72, 73%, which is again a relatively positive development. We provided a slight breakdown for the committee just to see by three different regions in terms of east, north, and west. And just for the committee's awareness. And thereafter, there are, within the reports we issued, you'll see 66 recommendations and 13 learning points. The learning points were individual learning points. There was no organizational learning points in quarter two. And there was 2 reconsideration directions arising from 1 case. We provided a breakdown of the recommendations on page 8. You'll see that further inquiry and reassess and provide a fresh response continue to dominate the percentages in terms of the recommendations we issue. Similarly, recording of the complaints remains one of the prominent categories in terms of our recommendations. We provided a breakdown of the learning points. Again, 22 learning points issued so far year to date. And we try to summarize them. You will see that naming the officers referred to in the complaint response letters features prominently there. Perhaps learning identified in relation to the use of the frontline resolution, where we felt it was attempted in the more serious cases where perhaps it shouldn't have. And also some learning points for complaint handlers to maintain a auditable record with the contact with the complainer. And that's probably the summary of a brief summary of the report provided. Happy to take any questions.
Thank you very much, Ilya. Can I invite members to ask any questions or observations at this stage? Fiona, please.
Thanks, Chair. Just a couple of things from me, Ilya, at the moment. So what you're saying in terms of sending things back, the complaints to be reassessed, I think maybe in low 30s percentage, and in the next line it talks about insufficient inquiry. It would be helpful for me to understand the difference that is. And then the other aspect, there's some, so it's great to see the improvements in terms of the some of the administrative arrangements, which was my understanding Police Scotland's intent when there was a new procedure, so that's always beneficial. There's variation from quarter to quarter in your findings in terms of sometimes it is not as poor as if I'm using that word as this report. Is that just the natural variation, do you think, in terms of complaint handling, or are you seeing any trends that are more worrying in terms of how complaints are being handled?
Okay, I'll address your first point. In terms of insufficient inquiry, those recommendations primarily relate, for example, where we can see that there is perhaps additional lines of inquiries that could potentially affect the determination of the complaint. Those perhaps were obvious lines of inquiry that we would anticipate that would have been undertaken during the complaint inquiry, but were not. So in those circumstances, let's say there is two civilian witnesses interacting with two police officers, and only accounts of two police officers and one civilian witness were obtained and considered during the determination. So effectively, we have one civilian witness who hasn't been spoken to, and when we apply the balance of probabilities test, you can clearly see that there is potentially additional evidence that was not obtained, which could have affected the determination of the complaint. So that may be, in terms of the additional inquiry. There may be sometimes recordings, telephone recordings, or maybe CCTV footage that perhaps wasn't considered. Reassessment of the complaint recommendations, again, that may relate to we encourage complaint handlers, when they respond to complaints, to advise the complainers of all the inquiries they've been undertaking, the evidence they've been gathered, and how it's been assessed. So, for example, if there is a number of various evidential elements that are available, but in the determination of the complaint, some of those perhaps have not been taken into consideration, and in our view, they could potentially affect the outcome of the complaint, that we may refer it back so that all of the evidence is considered, and thereafter a fresh response is provided to the complainer. In terms of your second point, yes, there are variations, I suppose, from quarter to quarter. Again, there could be a variety of reasons. It may be that we've dealt with a certain case with a very significant number of heads of complaint from a certain area, and if, for example, we consider that a significant number of complaints were not handled reasonably within that complaint, that could affect the quarter figure for a specific area. But also, you have to take into consideration that potentially staff leaving, new staff starting within professional standards department maybe take some time to get some training, get some training presentations, get up to speed. That could potentially affect the quality of complaint handling as well. So there could be a variety of reasons. I think generally speaking, and I appreciate that we moved from 79% in quarter one to 66% in quarter two. Year to date, I think we're still at 72%, which is good position to be in. We want to be better. Let's be honest about it. We want to be better. I think, as I said, a lot of new people started within professional standards department. I've held some discussions with my colleagues within the PSD to try to set up some training inputs like we did last year, which I think were very well received and I think appreciated by new complaint handlers. So we're hoping to put that in place, and hopefully that will affect the quality and improve it again going upwards.
No, that's really helpful. Thanks, Elia. Thanks, Chair.
Thank you very much for that. Katrina, I've got you down next.
Thank you, Chair. Elia, thank you very much. And following on from Fiona's question, in a sense, if the overall trend is a kind of improvement in complaints reasonably handled, have you got any comments about why the North appears to be going against that trend, and have you been able to identify a reason for that?
I don't know if I'm better placed to answer this, or maybe our colleagues from professional standards department. It's difficult to say, Katrina. As I say, it may be that there has been a number of cases handled by maybe a specific complaint handler that perhaps haven't been dealt with to the required standard. It may be a number of new recruits who are still finding their feet in terms of complaint handling. I don't think I'm able to pinpoint it on a specific reason.
Sorry, Ilya, you just cut out there literally, I think, for the last 30 seconds.
Sorry. Yes, as I say, it's difficult for me to identify any specific reason for it. On occasion, you still see that some complaints that we review are perhaps handled not necessarily by a professional standards department, but perhaps by specialised department. That could potentially affect complaint handling as well. So it's difficult to pinpoint it on a quarter by quarter basis. It's certainly something that we have a monthly meetings with the different regions where we have an opportunity to discuss any arising issues or arising any specific cases and so on. So we certainly have good contact with various regions, but it's difficult for me to provide a specific reason why there is a variation.
Yeah, thanks, Chair. Do you mind if I come back on that? I don't want to kind of get into witch hunting or anything like that, you know. But if it's over a period of 4 quarters, that's a trend or an anti-trend, if you like. You know, it might be. It would be good to identify what the issue is, and I'm also wondering, when you say that sometimes it's not handled by the professional standards people, that it goes to a specialist department. What could you just expand on that a wee bit, please?
So, for example, if it's complaints maybe relating to a very serious road traffic accident, that could potentially be handled by the road traffic division. So just simply a specialised area. But I can tell you, and I know that the north looks, I suppose, the worst in terms of the percentage in this report. Certainly last year, north and east were the two areas that were outperforming the west very significantly, and in fact were leading the way in terms of good complaint handling. So it's not something that a trend that has been persisting for quite some time. On the opposite side, I suppose the west was lagging behind slightly the north and the east last year. We certainly had a lot of discussions with the team in the west. There's been some additional resources going into the west, some people changing in the personnel as well. We did some work with the new recruits as well. So the west is now leading the way. So I think this quarter is perhaps not necessarily indicative of a significant issue in the north, but it's something that we will keep an eye on, and we'll certainly liaise with our colleagues in the north and see if there is any assistance we can provide.
Thank you.
Thank you for that. Yeah, I see. Kat, would you like to come in from this point?
Thank you, Chair. I was just going to clarify that the new complaint handling model, the instances of specialist departments taking on complaints, shouldn't be the case now. There are some legacy complaints that still sit out with PSD, but by and large, the aim here is that PSD will take the complaints on.
Thank you for that clarification. Thank you. Okay, Paul, you've been very patient.
Not at all. It's just to come back to the question I raised before on the Police Scotland report, which is that there were 99 statutory referrals, 82 of which didn't require a PERC investigation, which means 17 did. And my question is, how do we track that? Because actually I can't see anything that looks like 17 on this, and it could be a timing thing. So it's how we track that on the Police Scotland performance report, and how do we find that on this report, so that we're able to get some accountability and some feedback for whether these have been upheld or not, for example.
Thank you, Paul.
Thank you, Paul. Phil, I don't know if you want to maybe.
Yeah, I was going to come in there. It's probably something I can pick up during the course of my input, which follows on from Ilya's input, Chair, if that's permissible.
Okay, that's fine with me.
Okay,
thank you. Sorry, just before we move on, thank you very much, Paul. Let's just keep your question in all of our minds. And Phil, maybe because Phil, welcome, and just maybe before you just start, just something again from me, because again, fresh pair of eyes looking at this report. And it was absolutely fascinating to hear around sort of the aspirations, and whether 66% or 71 or 72%, whether that's good or bad. And I suppose everything is really relative, so it's really important to know what is the baseline where we're starting from. And really appreciate the effort that goes into improving this percentage, moving that certainly much higher. And by the sounds of it, the new complaints handling model is going to help. So that's kind of the trajectory. That's the aspiration. And just something again where I was reflecting on some of the learning points that I've seen here, because obviously, if these are the learning points that are coming out of of those cases which are deemed to not have been handled to a reasonable standard, a lot of them to me certainly fall into a procedural weakness kind of category. So I'm not necessarily looking at them, I'm not necessarily seeing major issues, but there are certainly things that a really well structured procedure and training that complaint handlers can adhere to should, in my experience, help. If we're looking, for example, use subject officers' names, I mean, that's something that's a relatively simple one, right? Something along the lines of the letter needs to be signed off by an officer at least a rank more senior. Again, that's another relatively simple improvement to make. So my perception is very much that none of these are insurmountable problems, and certainly I would expect, as the complaint handling model is bedding in, I would expect that those types of errors to reduce, because there are definitely things that can be improved with training, with procedures, with just something that really guides the inquiry officers down a particular path. I don't know if that's kind of your perception of this as well, or Kat, but certainly I was a little bit, I have to say, my reaction was a little bit like I was quite surprised at 66%, because I know that the aspiration is for all complaints to be handled to a reasonable standard, so I would expect it to be much higher. But actually looking at the learning points identified, there wasn't anything that was jumping out at me where I felt this was really a substantial kind of overstepping or deviation from procedures. Is that a fair assessment for somebody who's new to this, or would you disagree vehemently on this?
I think no. I think you're absolutely right. I think there are two I suppose main categories of learning points. Some are individual learning points where we perhaps provide some guidance to the complaint handlers to try to improve the complaint handling, and those will attach to the individual cases. There are occasional, and those are, suppose, in my view, quite important. Sometimes organizational learning points, for example, where through our complaint handling reviews, we can identify a gap in the procedures or guidance available to the officers. And so far this year, most or all of the learning points are individual rather than organizational, but certainly the learning points are not necessarily just for a kind of small improvements in terms of complaint handling. They're quite often organizational in terms of general training or standard operating procedures or other protocols and guidance. So you're absolutely correct. But I think it's also important, as we promote the culture of learning and improvement, it's not the learning points are not necessarily attached only where complaint is not reasonably handled. In many cases, there may be, complaints are handled to a reasonable standards, but there is perhaps an area where we identify where there is a potential improvement can be achieved. But also, I think it's important to consider that if we identify very serious complaint handling failing, then we ordinarily would probably deal with that as by means of reconsideration direction if it's something really concerning. So learning points are really reserved for trying to promote that culture of learning and improvement. So even when complaints are handled to a reasonable standards, there is still potential to improve upon that. So yeah, there is. I would be really worried if there was something extremely concerning in those learning points, but they're simply designed to try to improve the standards of complaint handling.
That's incredibly helpful. Thank you very much for that. And just another point, linking back to Katrina's earlier point around the performance of the North. Again, if you maybe just help me with my understanding here, because I think it might be really relevant to the conversation. So what you're seeing isn't necessarily a representative sample from each of the regions, is that right? So you're reconsidering investigations where an application has been made. So it's not necessarily a statistically representative sample of cases that you're looking at, across each of the divisions. That just happens to be the bucket that's kind of being submitted. So so I think any kind of analysis of your data needs to be viewed against that particular fact, that it's a very specific sample and tends to be quite random.
Yeah, because I think what you have to take into consideration that generally speaking, I think if you look at the North may amount for about 22-24% maybe of the overall complaint picture. So, and it's probably similar in terms of the number of applications for CHRs that we're receiving. So in terms of the number of cases that were completed in Q2, we're talking about 51 individual CHR reports. So naturally, the North being a smaller area will probably account maybe for maybe in the region of 20-25% of the reports from that number. Now, as I said, you may have one big case with a lot of individual allegations that perhaps we disagreed with the approach adopted by an individual complaint handler. That can have a quite significant effect on the percentage for the North for individual quarter. So and yeah, you're absolutely right. The figures we're providing are in relation to cases that are brought to us for a complaint handling review. So it doesn't mean that it's a definitive representation of overall complaint handling within the North. So I think probably the annual figure is probably slightly better reflection because it's naturally a bigger sample. And thereafter it allows us to maybe draw some conclusions and look into it in a little bit more detail and try to effect some change.
Yeah, no, thank you very much for the clarification. I really appreciate this. And I still think, despite all of this, I still think Katrina's point still absolutely stands, that, if there seems to be a trend of some sorts, it is well worth having some probing and just trying to get to the bottom of that. So I know, thank you very much for that. Are there any questions, just considering the debate we've had? Any questions, observations? If none, then Phil, over to you, please, for your part of the report. Thank you.
Thanks, Chair, and morning to everyone. Apologies at the outset for my late entry into the meeting. I was dealing with another operational matter. So to take you through the investigations paper, John Exploring, the head of investigations, would normally present this, however he's off. So I will do my best to take you through the facts and figures that we've got here. Probably to deal with Paul's point earlier on, page 11 sets out the PERC investigations, if you like, our process. So Chief Constable has a statutory responsibility to refer to the Commissioner any of the incidents which are contained within the descriptor at the bottom. It's footnote number 9, which in essence breaks down into deaths following police contact, serious injuries following police contacts, firearms discharges, presentations, taser and PAVA. Article 3 and 5 we've taken out of this report, as some members will be aware. After the 4th of October of last year, Dame Eilish's recommendation was implemented, which then saw a letter of direction from the Crown directing all of those investigations. So they are reported separately and directly to the Crown, so they're not referred to in this report. However, the Crown can also obviously refer to as the deaths in custody and various other things. Now, the key element to that is that the Commissioner has no discretion in terms of a Crown-directed investigation, however, does have discretion in terms of the police referrals from the Chief Constable. what happens when we receive a referral from the police is that we submit that through our assessment unit, where it goes under a rigorous process of assessment by a team of staff who basically look at all of the facts and circumstances surrounding the referral. And just as by way of an example, it might be helpful just to kind of put this into some context. So in this report, we've reported that there are 3 firearms discharges, which members might sort of raise an eyebrow at and think, you know, that's 3 separate discharges of police weapons. What I can say in relation to them is that one related to the human dispatch of an animal under a vet's guidance and instruction, and the other one related to faulty ammunition, which was assessed by the force's armourer. So when those 3 incidents are taken without any context, it looks quite significant. However, when we take them through the assessment phase, we look at all the elements of it and decide whether or not it's, you know, it meets our threshold for an investigation to be conducted. And the one which is being investigated relates to a potential negligent discharge within a controlled environment. So, if you like, once we go through our assessment, and depending on the nature of it, it can be things like deaths in custody, various other things. Now, because of the advent of body-worn video in particular, which has been a really good development from the PERC's perspective alone, it gives us an outstanding evidential opportunity right at the outset to understand all the impact factors that were impacting, particularly for the authorised firearms officers. So what we found is that it's a essential tool now to us in terms of how we're investigating, particularly the firearms elements, where you've got taser discharges, where you've got officers there who best evidence is the camera that they're wearing on their vest, I would argue, or the CCTV it's there, which allows us in a very short period of time, once the police provide all the papers, all the material that we've sought from them to discharge the assessment phase, we have 5 days in which to carry out that assessment, which is relatively straightforward in most cases. And if it gets to the point where we look at that and we deem that there is potentially the incident requires to be a proper full investigation, then that will be passed to our investigations teams to then conduct a full investigation. Where we deem that there is a sufficiency of information and evidence contained within it, where we are content that the officers or members of police staff have acted within the protocols, the standard operating procedures, or the guidelines, then we will put that back to Police Scotland to advise them that we are not going to proceed in relation to a full investigation. So if you like, that's the kind of the discretionary element, because without the context around some of these matters, you know, we've got referrals in relation to deaths following police contacts, where it can be 3 or 4 days following the contact with the police that the police have decided, quite rightfully in my view, that they have to refer themselves to the PERC. However, when we look at that in isolation and independently, we see that that person has been engaged with family, with indeed their health workers, their social workers, and various other organisations, that we can take a holistic approach to that and deem whether or not there's going to be a requirement for a full investigation to be conducted. So hopefully, Paul, I don't know, I'll pause there just to see if that deals with the kind of the query that you had.
Chair, if I may, it's just in the Police Scotland report refers to 99 referrals,
Yep.
and on for Q2 of this year. Your report says it's 144, which is 45 more. Of those 99 referrals, they said 82 didn't require a PERC investigation, which means obviously 17 did. So I'm looking at the second chart there, which seems to have 1, 2, 3, 4 investigations rather than 17. So I mean, I can understand if there's a timing differential or whatever, but 45 is quite a substantial amount more, and I wouldn't suggest that a week to either side. And 4 isn't 17. And my question is that where do we track these and track the outcomes of these?
Yeah, I'll happily take away an action just to clarify the position. there has been, because this is a new innovation, if you like, and I think it was in response to a question that Fiona had raised at one of the meetings to ask if we could produce stats from the investigation side. Previously, there was no interaction in terms of the statistics that we were holding, because obviously we are independent of the police, therefore you know, we shouldn't be sharing that kind of level of information. We had got to the point, and I appreciate it was before Kat's time, but John and myself had sat down, John Patterson had sat down and worked out a process by which we would share the information in advance. Now, there is always going to be a statistical anomaly in terms of when the referral comes to us and then when we make our decision. And in particular, for some of these cases, we can wait for several weeks to get material, whereby we then rely on that material to give an outcome, to give a decision back to Police Scotland and do the formal notification as to whether or not we're actually going to move that to an investigation. But I agree, 45 seems a kind of quite a significant disparity, certainly in the actual number of total referrals. So, Chair, if you're happy, I'll take that up as an action.
13 is when you're looking at 4 and you looked at 4 a year ago. Does that mean that it's just generally about 4 a month you're doing? In which case, are you backing up, or is there a backlog, or you know, because 13 is quite a substantial difference. It's like 4 times.
As of Monday of this week, we had 61 open inquiries that were sitting as referrals. Now, there's different stages to the referral process, because it requires to go through our, if you like, supervisors within the assessment unit, the deputy senior investigators, and then a senior investigator to give that decision. So, you know, we are experiencing pretty much static. It's not a significant increase. I know the stats are there, you know, the Q for the comparative analysis between Q2 going on to the first chart on page 12 there. Is 124 to 144, and you'll see again the firearms presentations make up a significant part of that. What I would say in relation to that is because we are required to assess them to the nth degree, there is nothing in there that if we had identified that there was an issue in terms of learning or issues in terms of policy and practice, we would move that to an investigation. You know, if you know, some of these as well, if they're thematic. So there's been recent commentary around about taser in particular, and particularly around about children, and some of the press reporting which was inaccurate. But you know, for us, we will look across all the facts and circumstances, and even though we think there's CCTV and everything is within the guidance, we will still exercise our discretion to take a representative sample, just to make sure that from our perspective, the post-incident procedures, etc., care for the and welfare of the individual that was discharged, that we consider all of these elements.
Yeah, no, I'm not questioning the follow-up and or whatever, it's the conclusion or whatever. It's simply the statistical anomalies.
Yep.
And are we missing something? And obviously the knock-on impact is if you've got them backing up and you're saying you don't really, is there a resource issue or something we need to address, or needs to be addressed, whether it's by us or by government? So anyway, I've made my point.
Thank you very much. I think, Phil, what you're suggesting sounds entirely appropriate. As an action is warranted, just to look at this and exactly see how the data can be presented in a way that accounts for all the variations. Thank you. I see Grant, you'd like to come in.
Yes, thanks, Chair. And thanks, Phil, for your explanation so far. In fact, one of the things I was going to ask about was how many open inquiries you have, and you've just answered that. But I wonder if you could say a little bit about how you feel you're resourced to be able to complete investigations within a reasonable timescale. One of the things we've been talking about earlier on in the meeting, and it will come up again later in the private session, is some cases seem to take quite a while. And I wonder if that's down to lack of people with particular skills, or is it the process, or are you just under-resourced to be able to move things forward at the pace you would like to, so that we can understand if there's anything more that could be done to help. I know you particularly highlighted body-worn video, which is something that as SPA we've been looking at in more detail. And at Resources Committee last week, we had a presentation on the merits of this, but also the challenges of being able to roll it out with sufficient pace to satisfy people's requirements. So my question is really just, is there anything that we could do to learn a bit more about the challenges facing you in terms of your own resources to be able to complete things at in an acceptable timescale?
It's a good question, Grant. For us, the world's changed dramatically since we've taken on the extra responsibilities surrounding the investigation of Article 3, which is criminal allegations of assault against the police. We don't report those statistics here. They sit directly going to the Crown. However, that is a substantial body of work now for us, and it does impact on our ability, because discretion sits within our in the Commissioner's gift. The Crown are always, particularly in deaths, we have got specific tight timescales when you're dealing with families and bereaved. That we need to make sure that we can respond to them quickly, effectively, to get a resolution, particularly, always going to be in very trying circumstances. Does that have an impact on our other core work? Undoubtedly it does. Are we still meeting our KPI as set and has been set for a couple of years? We're struggling. That's the harsh reality of it. Now, that is purely because the Dame Eilish recommendations being implemented. Yes, we've had an uplift in staff. However, the workload is substantial. What the benefits, some of the business benefits, are derived from things like CCTV in custody suites, CCTV in public space, because for us it gives us a very quick opportunity to go and assess what has actually happened, because officers will have CCTV, whether it's on their person or coverage from public space. If we can get to that quickly, then allows us to take a decision almost instantly, to be quite frank, to say whether or not there's going to be a requirement for us to investigate something. Now, some of these matters, depending on what they are, if you didn't have the advent of these investigative tools, then you would see that every one of those 3 firearms discharges potentially could have landed up going to full investigations. Now, these are significant investigations, and that all is going to have a knock-on impact to our day-to-day business. Are we resourced to a suitable level? No. Do we understand the true impact of the Article 3? Probably. We're just starting to see that, because we're at the point now that we've got 18 months of data to draw down on from October, and we can actually now 12 months to get a proper understanding of the potential impact on the park and our ability to do that work. And the annual report from the Commissioners going to be laid in Parliament hopefully next week, so it'll become a matter of public record at that point what that impact actually is.
Okay, thanks, Phil. That's very helpful. Thank you.
Thank you, Grant. Thank you, Phil. Really interesting. And I also really appreciated how you have quite, because that was one of my questions, is what sort of interrogation do you do before you decide whether or not to proceed to a proper investigation? And I think that was quite a fulsome and really helpful answer. So really appreciate that. Okay, are there any other questions or observations at this stage from anybody? No? In which case, thank you very much for
Chair,
this.
could I just ask if it would be appropriate for me to leave the meeting at this point, please, for other commitments?
Of course. Thank you very much
for your
time. Thank you.
you
Bye. Right, so we are moving swiftly on to agenda item 6, organizational learning, and this is presented for discussion. Darren, I believe you will talk to this item.
Thank you, Chair. Thanks, colleagues. Again, I'll take the paper as read and just draw out some key themes. A key commitment of the SPA is a culture of organisational learning, and specifically in the context of complaint handling, we identify learning through a variety of sources. Specifically, whenever there is consideration of individual complaint cases, we always look to identify any potential learning opportunities, as well as if there are any complaint handling reviews via the PERC and through benchmarking good practice. Members will appreciate, as I mentioned before, that the low numbers of relevant complaints that the authority receives within its remit, and given the breadth of its remit in terms of both senior officers in Police Scotland, as well as both the SPA itself, as well as its corporate and forensic staff, there's a broad range of potential complaint types. So particularly in over a smaller time period, you would expect there to be little in the way of common themes or trends. So hence why we're bringing this report forward just now, looking over a longer reference period of 5 years. And this links to an earlier report from a statistical analysis of complaints that came forward earlier this year in terms of the 5-year trends. And it follows an earlier organisational learning report, which was presented to the committee in 2018, which covered the sort of first 5-year period following the inception of the SPA. And it provided us an opportunity indeed to compare with any learning that was identified in that earlier report a number of years ago to ensure that there was no recurrence of matters which had arisen. So bearing that in mind, in terms of themes, there are probably kind of 3 main categories of theme that we draw out. And the first, and I suppose links potentially with Grant's question earlier on, which was around about senior officers and responding to correspondence. So when I answered earlier on, I was very clear to talk about we don't receive or there are no themes in respect of complaints which have been brought into Police Scotland, which are then escalated to the senior officer and then become a senior officer complaint. What we're talking about here is largely general correspondence, general contact into the police through a senior officer's contact point, where members of the public have expressed concerns to us that they've not received a response. And as a result, that then falls into the category then of becoming a complaint against a senior officer. This was something that was identified in that earlier learning report back in 2018, and actions were taken to address that. And we recognise that, as you'll see from the appendix to the report, that does still present as an issue. I mean, when these complaints do come in, they are ones which are easily resolvable through that early stage resolution process, the team get in contact with Police Scotland, and these matters are very quickly resolved. But nevertheless, they are avoidable, and we recognise that there's further work we need to undertake in liaison with Police Scotland in that regard. There are a number of quality service themes which I'll come on to, which are under 2.4 of the report. And the last one as a kind of key theme is around about categorisation of complaints. And when you look at the annex to the report, you'll see that in the first 2 years, 17, 18, 18, 19, there's reference to sort of grievance and other type matters that were recorded. And essentially, and as you'll recall from our complaint handling procedures, and one of the points that Dame Eilish pointed out in our preliminary report was the need to correctly categorise complaints at the earliest possible opportunity. And one of the key points of learning from the authority over those couple of years was around about complaints wrongly being categorised as being relevant complaints when in fact they were different types of concerns, for example, grievance type matters. And the reassurance that I would offer is, as you'll see, that there are no complaints sitting within that category at all thereafter. Moving on to the specific points of learning. We heard today around about sort of learning from a procedural perspective, and there have been through complaint handling reviews over a number of years ago commentary similarly to what you heard earlier this morning or in earlier discussions around about Police Scotland around scope for further inquiries to be conducted or for a fuller response to be issued. The team have made significant improvements to our internal processes to ensure that these don't arise again, and touch wood, we have had no concerns in that regard since, which we hope means that those processes are working well. Looking specifically in terms of complaint circumstances, you'll see that there are a number of instances that are called out there. Again, noting the point earlier on about the breadth of these. In each instance, however, where learning has been identified, action has been taken in response, and no similar complaints have arisen. And then the final point to note in terms of learning is really in terms of benchmarking. So key pieces of work that the team undertook this year were to benchmark against the Scottish Public Services Ombudsman Model Complaint Handling Procedures, and also ISO International Standard Complaint Handling Procedures, not specifically in the context of policing. And positively, as reported before, whilst there were no major differences, we did identify further good practice which could be incorporated into our team processes, which included the benefit of having a centrally recorded repository for capturing our organisational learning over time, which is hugely helpful in then being able to look back and monitor any trends and make sure that similar matters are not arising. So in conclusion, the complaints, SPA complaints processes have evolved in terms of our ability to identify and capture learning opportunities, and that's evidenced by the adoption of learning from our earlier 2018 report. But nevertheless, we'll continue to develop our processes to ensure that learning is embedded in the handling of complaints. Thank you, and happy to take any questions.
Thank you very much, Darren, for the report and for this presentation. Trina.
Thank you, Chair. Thanks, Darren, for that. It's very clear. It's really interesting, and actually, I'm really interested in the item on the complaints about SPA staff, the HR type issues that have been taken out of that, been dealt with elsewhere under grievance proceedings or whatever. I'm quite curious about that because in my head I'm thinking, well, it could be that things are dealt with in a sort of HR grievance processes, but I would be quite curious to know if, say, for example, different members of staff had complained about a specific senior person or line manager, if there's a kind of multiple complaints. That I'm just wondering what the process was that brought about the decision to take those kinds of complaints out of the category of formal complaint in this context. I don't know if that makes sense. I hope it does.
It does, Chair. Thank you, Katrina. So I suppose two different things, Katrina. The first one, this is, I suppose, is around about correct categorisation, and ensure that we go down the appropriate, correct route in the first instance. So it's not to say that these matters are not handled. It's around about at the earliest opportunity, satisfying ourselves with what we have is actually a relevant complaint as defined in legislation. The criticism that was made by Dame Eilish was that often the organisation in the past had gone straight to a complaint route, when in actual fact matters didn't meet that definition and should be progressed through different routes. So it's not about non-progression, it's about correct categorisation. And to that end, I suppose it's then being clear, and we capture this very clearly in our complaint handling procedures, which, as you're aware, we're currently consulting on a further revision to those, around about the routes through which such matters are addressed and whether or not those are within the scope of, or the extent to which those are within the scope of the authority to deal with. So to your point around about grievance matters, in terms of senior officers, for instance, one of the points that Dame Eilish again makes in her report is around about these grievance type matters being dealt with as grievance type matters, again without recourse in the first instance to misconduct, as is expected out with policing. Matters of a grievance nature should be considered through the appropriate grievance procedure, which in policing terms would be consideration by more senior management. There would only be exceptional circumstances where matters wouldn't be considered by, for example, the Chief Constable or one of the deputies, and only where, as a result of the conclusion of those grievance matters, if there was then cause for concern, would you go down that other route. I hope that makes sense.
Thank you. It does make a lot of sense, and I certainly wasn't suggesting that this was indicating there was no action taken in terms of. So I was thinking specifically about the HR type issues under SPA staff. So I wasn't suggesting that, you know, because it's not included in this context, there's no action taken. But I'm still quite curious about the lack of recording if people are actually putting in serious complaints. Now that may then get dealt with in an HR process. But there's a bit of me still a bit kind of, yeah, but if it's a serious complaint, or, you know, I don't know, maybe I'm possibly talking nonsense here, but maybe catch up with you offline on this one, maybe.
Yeah, of course. I mean, just to conclude on this point, Katrina, is I suppose being thoughtful of the locus of this committee and its oversight in respect of complaints and conduct matters, but nevertheless recognising the locus of the People Committee in terms of broader employee relations matters, including but not limited to grievance.
That's helpful.
Thank you very much. Thank you very much, Katrina. I think it's a really valid point, and I think absolutely. I was just going to say People Committee as well, because I'm mindful that there's probably an overlap when it comes to sort of the grievances and HR type issues. So, but it's a really valid concern to raise. So, thank you. Grant.
Thanks, Chair. Darren, a very helpful summary of the issues. Thank you. One of the in fact, the largest current complaint about senior officers in relation to not responding to correspondence, and you've explained in para 223 that this is still under investigation. But I wonder if at this stage you could clarify whether in fact this is simply saying they're not responding quickly enough, or the content of the correspondence isn't actually satisfying the complainer, which has led to the complaint coming in.
Thank you, Grant. Thanks, Chair. It's the former. It's simply that matters have not been responded to, and therefore individuals have contacted the SPA.
Right. So that actually probably gives a particular path to direct appropriate effort into making sure that the senior officers, staff officers perhaps, are able to actually keep track of these sort of things to move them forward a bit faster. Right, thank you. That's very helpful. And obviously you're still working on this whole analysis, so maybe more will come to the surface in due course. But I think that's very helpful. Thank you.
Thank you.
Thank you very much, Grant. Thank you, Darren. Are there any other questions? No. Well, in that case, thank you again for all the questions and the really fulsome presentation on the subject. So we are then swiftly, in fact, I am conscious that we have been going for almost 2 hours. May I suggest a 5-minute comfort break if we sort of come back to roughly at about 1:45, 1:45, and then we continue with the agenda. Is that okay?
Okay.
Perfect.
Okay.
Thank you. for coming back in a timely fashion. We'll suggest we continue with our agenda. And so the next item that we have is a paper from Police Scotland around complaints drivers. And I believe this one will be introduced by Katrina.
Thank you, Chair. Thank you, Chair. So this paper compiles some details around about the three subjects of discriminatory behaviour, quality of service complaints and irregularity in procedure, and this has been produced in response to a specific request from yourselves. We've shared the paper in advance, so I'll take the content as read and just pick out some key points, if that's in order, Chair. So of the 120 allegations of discriminatory behaviour that were received between year 2021-2022, this is an increase of 17 allegations on the previous year, and also an increase of 36 allegations in the 5-year period as well. Our assessment is that this may well be a reflective of a change in public expectations in terms of what is assessed to be acceptable behaviour of officers, as well as an increase in potential increase in public confidence in terms of reassurance to report. Of the 120 allegations received, 60 of those were attributed to the West, 32 to the East and 28 in the North. Each complaint is broken down into one of the 6 subcategories. So when you look at the race subcategory, we see that of the 60 relevant allegations within the race subtype, the majority involved male complainers as opposed to female complainers. The complaints themselves related to perceived discrimination of individuals from a non-white European background. Those complaints related to 32 of the 48 allegations which involved a specific ethnic background. Of the 60 allegations with the race subtype, the majority involved complainers that had been subject to police action. However, there was a further element that involved complainers who were reporting matters to the police. In terms of allegations from the gender subtype, of the 29 allegations from the gender subtype, 16 related to a male complainer, 11 related to a female complainer, and 2 related to a transgender complainer. In half of those reports, a male complainer perceived discrimination by police following their involvement in a domestic incident. Of the 29 allegations, 11 involved a female complainer, where 11 involved a female complainer. The issue related to the attitude of subject officers who were referenced when communicating with them around their actions and were broadly perceived to have been discriminatory on the basis of their gender as a female. The vast majority of these related to a perceived lack of police action in relation to various incident types, such as missing persons, domestic incidents, harassment and assault. In terms of outcomes for allegations around discriminatory behaviour, 2.7% of the allegations were upheld. In respect of subject officers, we've done some further analysis around subject officers linked to discriminatory behaviour allegations during the course of 2021-2022. We could find no concentration of subject officers at any specific station or shift or any relevant pattern, and found that subject officers were widely dispersed across the country. It was notable that the service bracket of 2 to 5 years police service accounted for the highest volume of complaints. Chair, if you're okay to move on to quality of service, I can give you a summary of the findings in terms of quality of service. So given the volume, the volume that's involved with quality of service complaints, the information provided within that aspect of the report has been provided by way of a dip sample of the categories with the highest volumes. The findings generally related to quality of service issues around a lack of update being provided to the complainer. That was the most prominent theme, as well as officers not pursuing a course of action that would indeed be expected by the member of the public. Many of these reports being in respect of neighbour complaints, and also the manner presented by an officer was also a concerning theme. Lastly, irregularity in procedure. This action was to provide clarity round about the other category attached to irregularity in procedure, which is the most prevalent category. Again, the analysis was carried out by way of dip sample, given the volume in terms of the 760 reports. There was two main commonalities found during the dip sample, and that related to COVID-19 matters, such as officers not wearing suitable PPE. This was identified within 63 of the dip sample allegations, and also perceived honesty and accuracy concerns around police accounts. For example, perception being that officers provided misleading statements to complainers. This was identified in 25 separate allegations from the dip sample. That's the highlights of the report provided, Chair.
Thank you very much for the paper and for the introduction to this. Can I open it up to members for questions or comments? Katrina, was that a hand? Katrina, please.
Sorry, my cursor's having a kind of wee wobbly. Yeah, it was something around, I suppose similar to the question I asked previously in this meeting, you know, about it's reasonable to assume that, you know, with lots of awareness raising campaigns on the go, that, you know, people would become more aware, people maybe feel a bit more confident. So again, I wanted to just check, you know, how you can actually evaluate whether that is what's happening. And particularly in relation to the section on, you know, the race-related, you know, items where it's the majority are men that are making the complaint. I'm quite curious about that, because as people here know, I've got a bit of a thing about intersectionality and how, you know, different kinds of, you know, protected characteristics may impact on one individual. So, for example, you know, women who are women of colour or black, or who are also disabled or whatever. So I'm quite curious about that. If you've got any ideas or any way of evaluating why that might be the case, that it's primarily men that are picking up on that kind of aspect of discrimination. And similarly, I think I have some questions marks, or certainly some curiosity around the issues around you know, the female complainers when they're complaining about response to domestic, for example, or you know, that kind of situation. I probably should actually, Chair, my apologies, I probably should have put my hands up in terms of you know, conflicts of interest or whatever. As you know, I've, you know, ran a charity for autistic women for 10 years. And certainly, you know, anecdotally, there were autistic women of colour were saying they you know, have anxieties, and the fact they don't contact the police because in the past they felt that they were being discriminated against. I can't back that up as evidence. I'm just saying these are lived experience reports, if you like. So that's I need to try to declare that as one of the reasons behind that question. For me, it's an area that I work in or have worked in. Thank you.
Thank you, Katrina. Pat, would you like to respond to some of this? Oh, and you're on mute. The first one today.
Yes, thank you. I'm not normally guilty of that. Thank you, Chair. So internally, we obviously proactively raise awareness around about all sort of the subcategories that we're looking at within that paper, to raise awareness and educate the officers about what potentially they may meet with during their course of duties, and we start that very early on in their career, and that's continued throughout their career. We've also internally got a number of diversity associations as well, where we actively seek feedback from them. There's monthly liaison meetings with all the diversity staff associations as well, which gives us good, honest feedback in terms of our approach as well, and any learning that we can implement from that as such as well. In terms of what we're about to embark on in terms of the professionalism and preventions campaign, that'll again be an opportunity to enhance education, learning and prevention round about awareness raising in terms of many of the matters of intersectionality that you've already spoken about, Katrina. In terms of seeking feedback round about the imbalance for male and female, I'll need to give that some more thought. About how we could actually do that as an organisation. There may well be measures already in place, to be honest, but I think I need to give that further consideration.
Okay.
Thank you.
Thank you very much for that. Fiona.
Thanks, Chair. And Kat, this has been really helpful. Thank you for your responsiveness to our queries. It's obviously been a lot of work to do that dip sampling and do it, and I hope you found it useful in terms of ongoing organisational learning. What I found interesting and helpful was it's quite disperse in terms of what you're finding, and at times difficult to find themes, but no less you're still taking the opportunity, particularly when if you're looking at the age and the experience of the officers, you're identifying opportunities of where you can have intervention which will try and improve that. So thank you for that. In terms of the later data that you've put in terms of the issues about quality of service, again, that was really interesting and helpful, and I think the way that you're taking it with an open mind, recognising that not all of police intervention is welcome, so therefore people are perhaps initially starting off being hostile, so it is quite a challenge for officers. I'm wondering about the learning from that, and is there any opportunity to aggregate learning, so things like, you know, lack of updates or lack of empathy I found interesting and dismissive regarding the complainers' concerns. I wondered if there was anything there, or is that the next step in terms of work in progress?
So lack of updates has been a fairly probably ongoing concern from the members of the public in terms of feedback through our public engagement surveys as well. So we're well aware of that. It seems to me that officers, that's something that could potentially or should be an easy fix in terms of just that regular courtesy of engagement and update and progress updates on a fairly regular basis. So internally in PSD, we're obviously still looking to push forward with the new complaint handling model. We're a year in now, so we've got a real opportunity at the moment to fine tune some of the arrangement that we have in place. You know, part of this, we're looking at updating the complaints standard operating procedure. We're looking at a slight tweak of our resource alignment and arrangement across the country, and again, some, as we've already mentioned earlier, some additional training. So these are opportunities where there's some basics like that I feel there's real opportunity where, I don't want to call it a quick win, but it should be, because that should be something that's automatic to an officer, that we engage with complainers and we keep them updated. Clearly we aren't, as well as we could be. So that's something that I think personally I would want to take on and try and push forward in terms of our complaint handling response within PSD.
No, I think that's helpful. Thanks, Kat, for that, because I understand what you're saying in terms of the quick win, but actually there's a number of, as I think Katrina talked about earlier, procedural areas where actually that are easy to do, and then that maybe gives the force confidence to recognise being open to feedback, you know, yourself within PSD about how you can build an improvement, and it also maybe clears some of the clutter away in terms of the analysis it gives you clearer sight on some of the bigger, more complex issues that you face. So that's grand. Thank you. Thanks, Chair.
Thank you very much for that. Grant.
Thanks, Chair. Kat, thank you. It's a very helpful analysis in this paper, and it gives a lot of information. Some of my colleagues have already touched on this to some extent, but in 153, Table 5, it shows quite an age, well, a service bracket, I should say, range. And I know that you've said that there's going to be further thought about targeting existing training or guidance across the service. I'm conscious that you are trying to do quite a lot of online training, because clearly getting people back to Tullyallen at different stages in service will have its own challenges. But I wonder if you could give us some sort of clue as to how long you think it's going to take to sort of roll out this form of additional training across what is really up to 20 years service, is with the peak areas that although you've said that 2 to 5 years is the highest, there's
Yeah.
still quite a range there, and these are only based on what you know already. It may be wider spread than you think.
Yeah, it's a good question, Grant. And actually what we've tried with the preventions programme is to think creatively about how we can land that educational messaging, and actually online training is not always the most effective, and it's certainly not the only way. So actually we have a communications engagement team that's linked in with our corporate comms. Now we've actually reached into them to allow them to, so they will actually go out and tour the country and actually engage face to face with somebody from our team and speak with members of shifts, etc. So that's an ideal way to actually focus on the service brackets that we're looking for. More often than not, these are going to be easily found within frontline shift officers. So, you know, that's a measure that we're absolutely on board with, and that's our first port of call with this preventions programme, is to try and get it pushed out there on a face-to-face basis.
Right. Thanks, Kat. That's very helpful, very reassuring. I
Yeah.
look forward to hearing how you're able then to in some sense, monitor how that leads through to a reduction going forward.
Yeah, thank you.
Thank you.
Thank you very much for that. Paul, please.
Yeah, it's just a couple of questions or thoughts, really. Is the under 5 years of service accounts for about 40% of cases of allegations, I should say. And is that because of inexperience? Is that because they're in the first 5 years of service, they're more likely to be out there rather than in a managerial role or whatever, and therefore they're more exposed? The second observation is that, can I be correct in this? It's only 2% of cases of allegations are actually upheld. And the report says the vast majority aren't upheld, and that's kind of straining the adjectives a bit, because, you know, 55% or 60% is the vast majority. 98% not upheld is somewhat more than that, I would suggest. So, so of that 5 years, there's 100 cases against men, for example. That's only 2 that are being upheld over a year. So it's not a huge number. So first question, anyway, that's, the second is an observation, not really. It's quite, yeah.
I agree with your first point, which is the observation round about the prevalence of officers within that 2 to 5 year bracket still being out in the front line, Paul. That would be absolutely accurate, and that may well be one of the driving factors as to why it's concentrated within that age bracket.
Yeah.
In terms of your observation round about the numbers of being upheld, indeed that is accurate. That obviously we assess our complaint handling round about the balance of probabilities.
Yeah.
So
yeah. But where I'm coming from is they're being complained about, but that doesn't actually mean it's actually happening.
Yeah.
So they're exposed in many ways. They're exposed to complaints as well, or to the risk of complaint. Yeah. Anyway, that's just my toughest worth in this, Chair.
No, thank you very much for that. In fact, Paul, you have taken away my own observation as well. The fact that we're talking about allegations made here. No, not at all. I absolutely agree. It's allegations made rather than allegations upheld. And this is a really interesting, I think it's a really interesting area, because just because somebody has complained and allegation hasn't been upheld, it doesn't mean that their perception of the situation isn't valid, because again, it's that balance of probabilities, so that's an important consideration. And that's why I think it is important to kind of talk about these numbers. But at the same time, there is always the flip side of somebody being complained about as well. And as Fiona has already, as mentioned earlier, not every police intervention is welcome. And quite often, by the time there is an interaction with the police, it is within the context of not your normal kind of daily business, so to say. So there will undoubtedly be a number of complaints that are driven by factors other than just this is a genuine kind of factual perception of the situation. So it's hugely complex, but it is this analysis is certainly a really kind of welcome starting point. And I think some of the discussion today already has indicated that actually there may be sort of some further avenues to explore. So I would certainly really encourage seeing some more management action kind of on the back of the step of analysis, with all the caveats around the fact that it is still relatively small numbers, etc. But it would be just really interesting to see what do you make on the back of this analysis. We really appreciate the effort that goes into producing these papers, but they aren't just for our benefit. Obviously, obviously the public interest element is an important one, but it's also hopefully it's going to be a management tool as well in some way, shape, or form. Fiona, you'd like to come in.
Yeah, it's just on reflection, having reflected on the passage of that conversation, and I think we did pick it up briefly at our seminar, and not necessarily for discussion today, but it's that 2% is quite a low number. So you're recognising the complexities of everything. I understand that. And I think I would look forward to ongoing dialogue about how we better understand. I think the Police Scotland have already said, actually, if you have body-worn video, it is much easier. That's a protective shield almost for the officers and for the member of public. So that will possibly help, but it's more, I would look not necessarily for response today, but I would look forward to ongoing conversation about how we get to that on balance, two sides of what has happened. And it's also being a grudge purchase, but also the perspective of the complainant as well, clearly, as the member of staff.
Exactly. No, it's a very valid observation. Is 2%, is it too low? Is it just the balance of probability? Is this, is kind of getting out of balance? These are all kind of questions that it's very difficult, and you're absolutely right. I mean, if technology can be a help here, then it's something that the authorities should absolutely be supporting.
But I think absolutely for not for judgment, but for learning and improvement.
Exactly.
So if it's how do we, and I think I recognised, Kat, in the report, some of it you were saying, well, this is the situation, but without prejudice, we're going to go in and train anyway. Which I think is a really positive approach. You're not saying, well, actually, we think we're not upholding that, so we're not going to go. You're saying, actually, this is the situation. We're going to go in and try and further improve our service and also protect our officers in the future.
Absolutely. Katrina?
Yes, thanks. And I just wanted to add, and I know it's slightly kind of off piece, but that one of the things I was trying to say was that, what about the people who don't put in complaints at all because they actually don't think it's going to be worth their while? And I know that's a different problem in a way, but I think it's worth raising in this context. But Katrina, Kat, can I just say, I do really appreciate the work that's gone into it, and it's such a really important, really interesting piece of work you've done, and it's a great starting place for us to have these conversations. Yeah. Thank you.
Yeah, really helpful. Maybe before, so just another final observation from me, just on the service, on the the delivery of service, the service quality of service section as well. So again, something that I was reflecting on because it is a really helpful analysis. And again, really appreciate the effort that went into this. Dip sampling approach absolutely makes sense when we're talking about sort of these numbers of cases. And what I was kind of reflecting on here, and I might sound a little bit like Caroline Stewart, whenever she brings up the question of, you know, this is our capacity to deliver service, and if there's kind of more demand on, then, you know, we either need to expand our capacity, or we need to kind of slice and dice the service that we can provide. And just, you know, so when it comes to and again, just maybe something to explore, maybe for sort of a future conversation, within that quality of service, again, absolutely appreciating that every member of the public who makes the point of submitting a quality of service complaint, or our complaint that we, you know, Police Scotland and later assess as a quality of service, their perception of that in this situation will be very, very valid. But there is a range, you know, I suppose there is a range from an organizational perspective, and also from an oversight perspective from us. There is a range of severity, so to say, or complexity. And, you know, and because we're seeing such high numbers, I'm thinking, do we have a way of isolating maybe some of these things? You know, because like some of the things, like somebody isn't keeping me up to date, absolutely really, really valid for that member of the public. But at the same time, it is possibly because that member of the service is responding to something that is more urgent or more pressing, or, you know, so it's kind of, in an ideal world, absolutely, you know, what I'm hearing today from Kat and from Debbie is that we would want you know, officers to keep everybody up to date, etc. But sometimes they're just more pressing policing matters that kind of take priority. So, and when we see that these quality of service complaints, kind of the numbers coming through, I certainly from an oversight perspective struggle really to kind of make sense of what are the really salient, kind of really important kind of themes there that really point to something that is systemic, that we absolutely need to address, versus some other, you know, what is the percentage that we would want to respond in a timely way, but we can't because of X, Y, and Z, you see? So, and I suppose that's the difficulty of trying to use complaints as a bit of a management information type data. But I would certainly kind of welcome some thinking around whether something around the quality of service, whether there is a degree of kind of, you know, giving us a sense for, yes, you know, some we absolutely need to improve, some we would want, but it's, you know, and some, well, it's a capacity kind of constraint, because at the moment I think it's really difficult to see that. And I'm not sure, you know, what's within the realm of the possible, but I think, again, certainly from a management oversight perspective, it would be helpful to kind of consider for the future. Okay, well, so I will take this opportunity, I think, if there's no other observations or comments, to move us on. So thank you very much for this report and for the discussion. I think it's really incredibly important that we had that. There were 2 actions that were attached to this paper, and I just wanted to check that members are happy to close those actions now we've had the discussion. Okay, excellent. Thank you. And the next one is a report on professional boundaries, the progression of recommendations. And again, Kat, I believe you're talking to that item 8. Are you struggling with your papers?
Apologies, yes, I'm just trying to track it down. I'll be right with you.
No problem.
Pat, do you want me to email over a version of it?
Maybe if you could just do that, Colette.
Yeah, I'm just sending it over now. Katharina, do you want Darren to take
Yeah, I'm just
item
thinking.
9.2?
I think I was just looking at the agenda. Let's just do that. Darren, are you okay to take agenda
Of course.
item? Yeah, perfect. Let's do that.
No problem at all. Thanks, colleagues. So this is a regular update on progress delivered against recommendations from the Dame Eilish Angelini review. And as you know, we cover those recommendations where either Dame Eilish herself and or Scottish Government had identified a specific implementation role for the authority, as well as others where we had identified such a role ourselves. Positively, of the 31 recommendations that we had set out previously in our action plan, actions linked with 26 of those are now marked as complete or proposed for completion within the current round of national government supporting arrangements. And of those specifically for the SPA, only 3 are outstanding. And to note that all 3 of those are, though, dependent on wider partners to enable closure. So given the fact that most of the recommendations for the SP are now complete or proposed for completion, I've adopted a slightly different reporting format from this point forward, really focused on those which are remaining. And you'll see that within the report, I specifically focus on those which are directed at the SPA in terms of recommendations 29 and 79, which are dependent upon development of Police Scotland reporting to committee, a subject that has been discussed a wee bit already today, and I understand through engagement with Police Scotland that there is a commitment to develop those reports over the next couple of reporting cycles. And then finally, the third one is recommendation 32, which is around about oversight of ethical matters, and there's a dependency there on some wider Scottish Government independent advisory group work, which is covered in the report. I also cover in the report those other ones which are not specifically for the SPA, but where they are of relevance, either because we're involved as part of wider partner work or where there are implications for our own workforce in one instance. So beyond the update and specific recommendations, I cover in here an update around about the wider progression of matters more generally. The report covers updates on recent meetings as part of national governance and reporting arrangements, and the timescale for forthcoming meetings, which will culminate in the publication of the 4th thematic progress report, which will cover the period up to the end of September this year, and it's currently anticipated that will be published prior to the December Scottish parliamentary recess. Also, members will note the recent public consultation on those recommendations from the review, which either will require or are likely to require legislative change or the introduction of new legislation. Following on from the end of that consultation in August, Scottish Government are planning to publish an independent analysis of responses, we understand, later this month, and a commitment has been given to introducing a bill on police complaints and misconduct handling. Was outlined in the Scottish Government's 2022-23 programme for government. So happy to take any questions.
Thank you, Darren, for this fulsome report and really good summary of this. Are there any questions from members on this agenda item? Fiona, please.
Thanks, Chair. Thanks, Dan, for that. I suppose the question I have in my head is, what are we being asked to do here? And you're asking us to discuss it, but it seems quite straightforward. And I'm assuming you're not asking for approval for us to be assured that the actions have been taken. This is just a note of progress to date. Because I think what I would find helpful is a list of the recommendations, a list of the actions that have been taken, and evidence of assurance. And I'm just not quite sure, but apologies, it's my fault. I should have looked up to previous papers. I'm just not quite sure where we are with that.
Okay, thank you, Fiona. Chair, if it's okay to come back. Fiona, apologies. This is probably just potentially as a result of the different reporting approach from previously, where we outlined all of the recommendations, actions, and closure. So happy to pick up with you separately, but essentially all of those SP actions which have been proposed for closure have been brought back to the committee for its satisfaction before we then presented them to Scottish Government, and the kind of broader overview of the range of actions closed is contained within those thematic progress reports. In this instance, I've tried in the narrative, probably it's not presented as succinctly given it's in a narrative form, the recommendations which are outstanding, the actions that we had committed to do under each of those things, and I suppose the current status of those, and primarily in terms of the three which I would focus on, those being for the SPA. That two of those are, as I say, related to essentially the development of Police Scotland reporting to the committee. One of those is in very high level terms around about the committee's ability to perform its broader oversight role. One of them is more specifically around about reporting in terms of timescales. And the report does outline, I suppose, the narrative of our engagement through the committee and with Police Scotland over the period since the publication of the report. And as I say, the current position is an understanding from Police Scotland that improvements would be made over the next two reporting cycles, at which point we would hope to then bring that back to the committee seeking approval to discharge on the basis of those developments. Similarly, the one around about ethical oversight, we're awaiting the report on findings from that Scottish Government Independent Advisory Group, following which, as outlined in the report, the proposal in respect of the SPA's approach to oversight of ethical matters within policing would be developed, and again we would be presenting back to the committee seeking approval to progress for discharge.
Okay,
Thank you, Fiona. Thank you, Darren. Grant.
Thanks, Chair. Darren, just following on from what Fiona has been saying, I too would find it quite useful to know whether both for SPA and indeed for Police Scotland, where agreement has been made to make some changes, to be able to actually do some testing as to are they actually delivering, have we got assurance that they are delivering what was intended? Because I can imagine a lot of recommendations being put in place for any organisation dealing with a report of this nature. There could be different scopes for interpretation as to, is a plan of action going to actually generate the right outcome? And I think over time, I think we do need to have the assurance that it is, or what further action is required to get there.
Absolutely, Grant, and to taking on board your point, I suppose where both for SPA and Police Scotland and indeed other partners through those national governance reporting arrangements up to and including the Minister, there is an assessment that sufficient evidence has been provided to discharge the recommendation. But as you quite rightly point out, that can be closure of an action, and the broader point around about the resulting impact, which will take longer to measure. And certainly something that as an SPA team we have ourselves identified as something that we wish to explore further in terms of those longer term impact measures. I don't want to perhaps put Maggie on the spot from HMICS, but am I right in thinking, Maggie, that actually there was something in the broader 3-year plan from HMICS that of a look around this? I may be entirely wrong, and apologies for putting words in your mouth if that's the case.
So there is an inspection of complaints and conduct in the next 3 years. I think it's in year 2 of the current inspection plan.
Thanks, Maggie. So yeah, very thoughtful that will also provide opportunity in terms of that, I suppose, independent assessment of impact.
Yeah, no, absolutely. And thank you very much, Fiona and Grant, for these observations, and Darren for your reply. I think there's definitely something here that I'm taking away from members, is that there has been a period of time has passed, or during which several recommendations have been closed off in a variety of ways. But I think that stepping back, that bigger picture as to what were the recommendations, what has been done, and actually most importantly, how will we know that it's having desired impact? I think that that's kind of the missing element, because the closure of an action and implementation of a new way of doing things does not necessarily equal to better outcomes. And whilst the HMSCS report in year 2, possibly depending on the scope, might kind of cover some of that, at least some analysis as to these are the actions taken, and this is when we would expect and potentially show the impact, and this is how we will know that, you know, that it is having desired impact. Some of that analysis might be really quite beneficial. Okay, perfect. Thank you so much, everybody, for covering this item. I think, Kat, we have got you back, hopefully with your papers, which is good. So that allows us to go back to agenda item 8. So it's professional boundaries. Over to you, Kat.
Thank you, Chair. Thanks, everybody. So this matter obviously follows on a previous update that we've provided to the committee round about proactive work that we're doing to address matters of professional boundaries. And we'd undertaken at that juncture to provide an additional and a regular update on the themes and the learning and what proactive work we were putting in place. So as the committee will recall, we did quite a detailed statistical analysis round about a case review that covered a 4.5-year period following the whole life sentencing of Wayne Couzens at the tail end of last year. And on the back of that, we've continued that momentum and continued that focus and the deep dive round about matters of professional boundaries. So that case review, the statistical analysis concluded in October, end of September 2021. So we've continued that statistical analysis between, just to round off that calendar year, and done some further work round about October to December 2021, and that showed up another 49 reports. In terms of the nature of those reports, the prevalent reports being around inappropriate comments and also inappropriate behaviour. So much like what we'd seen in the earlier case review of the 410 that we looked at. So from there on, we've started to do a 6-monthly analysis at the moment. So we have carried out a review between the 1st of January 2022 up until the 30th of June this year. The key findings of that are within the report that's been shared, but we've received 84 reports in that period, and 72 relate to named individuals, 12 unknown persons, and the most prevalent reports again are inappropriate messages and sexual assault. 26 of the reports are relative to off-duty matters and 53 on-duty matters, and to date we've reported 20 matters to COPFS, but again some of those investigations will still be live given the timeframes. You'll recall that a committee from the last case review, there was 19 recommendations that emerged from that. So the update round about the progress and delivery of those is that 12 have now been completed and 7 remain in progress. We have, as part of that, we've had engagement meetings with partners within COPFS CAPD, as well as Sexual Offences Unit, just to look at the findings of our case review, the analytical product, as well as discuss any opportunities for learning, improvement in approach, etc., just to enhance outcomes for complainers and members of the public. As we've talked about a lot today and previously, we have pulled together the PSD Preventions and Professionalism Board, which is the vehicle to drive forward the Preventions and Professionalism programme. The board has now met 4 times since May this year, and that is now instrumental and built into our governance framework within PSD, which is a positive. In terms of the Preventions and Professionalism programme, that was formally launched by the Chief Constable at the Senior Leadership Board last week, under the overarching values campaign. And again, that programme is designed, centred around the 10 standards of professional behaviour. It's a calendar of activity scheduled to take place over a 12-month period, and it's designed to challenge behaviours through ethical leadership, education and early intervention. And is anticipated that we'll start to see that programme being rolled out within the next couple of weeks. We feel that the programme really endorses our long-term commitment to addressing and preventing such instances and changing that culture and behaviour within the organisation. We are linked into the relevant National Police Chiefs forums across England and Wales, so we're actively adopting best practice from there, as well as keeping abreast of activity south of the border. In addition to this work, we're obviously acutely aware of the 2 recent reports that have been published, Baroness Casey's interim report on misconduct and also the HMI-CFRS investigation of vetting, misconduct and misogyny. We are now pulling together the recommendations within both reports and any themes to look internally and see if there's any learning that we can adopt and take on board as a result of what's already been reported within the public domain in those matters. Again, organisational learning, I've spoke about that earlier in the open session. Again, it's a key feature that we're working hard to try and enhance and develop our approach in terms of recording, governance, progress and tracking of all recommendations that come into us. And again, we continually promote the variety of measures that we have in place to encourage reporting, whether it be anonymous or otherwise, in terms of encouraging people to come forward and providing that reassurance that we will investigate and investigate thoroughly. That's a summary of where we're at. Chair, if you have any questions at all.
Thank you very much, Kat, for the paper and for the presentation. Colleagues, I see Katrina, you would like to come in.
I think really it's a comment really and a kind of observation. I really welcome this report. I think it represents, you know, I quite often talk about, you know, you're changing the organisation, a huge organisation like Police Scotland, changing the culture is a bit like, you know, turning a massive tanker 180 degrees. And I have to say, I think this report represents a very firm turn of the steering wheel, and I really, really welcome it. Thank you very much.
Thank you, Katrina. Fiona, please.
Same as Katrina, Kat, very much welcome this report. I think it is encouraging, and I think the whole thing about encouraging people to come forwards, the more it's seen in public, the more it's discussed and debated, the better it is. I think I heard, well, you talked about the 2 most recent reports being published. If I'm right, then I think you've answered my question. One came out of the Met in terms of they looked at vetting and they found that the vetting had, not that they needed to re-vet, but the vetting actually, the original vetting was inappropriate in terms of the officer had passed through vetting when they shouldn't have. So I'm interested to know if that's one of the reports you're looking at. And then the other aspect is, and it's possibly too early for this, but I'm interested in the person who's raised concern and their experience. So clearly not everyone, the concerns that are raised, not everyone is going to, it's complex. You may not be able to tell people of the outcome. Not everyone is going to be content with that. But actually in terms of seeking further organisational learning, I wondered if you could discuss with me what plans you have to work with the people who've raised the complaints in terms of their experience of their complaint being listened to with empathy and compassion and further investigated. And I recognise that that's a big ask because it's not easy.
No, it's a good question, Fiona, and more than happy to answer that. So I can confirm that we're looking at both the reports, Baroness Casey's and the HMI-CFRS report, both of which hit into vetting, and actually there's not a work stream within Professional Standards Department that between both of those reports is not impacted. So we're looking at that across the board. In terms of the feedback from reporters, so there's 2 strands to that, because sometimes our complainers will be internal members of our workforce in terms of matters of professional boundaries, and other times they'll be members of the public and sometimes vulnerable members of the public. So internally, we've got similar, the network that I've already mentioned round about the internal engagement network with the staff associations and diversity associations. So that is a steady flow of information where we will actively get feedback on our approach in terms of how we've addressed things internally, whether that be positive or otherwise, and we'll take on that learning. As recently as the last meeting, which I had a fortnight ago, I pushed out some learning in the back of some feedback that we got from the SWDF, which is the Scottish Women's Development Forum lead. Over and above that, as part of this preventions plan, then in terms of next steps, I think that we do have a gap round about reaching out into members of the public in terms of complainers for professional boundaries. Now, a lot of them may already be linked into third sector support organisations because of an existing vulnerability. Now, as part of what they've encountered due to what we would be speaking about, we would signpost them regardless to a third sector support advocacy organisation for that therapeutic side of recovery. So already the organisation's public protection network across the force, that's hand in glove for them. However, I do think there's a gap and an opportunity where I would hope that as an organisation we can get to the place where we can link into third sector and advocacy support organisations from the PSD perspective to raise awareness in terms of their learning and their vigilance about what the signs might be of an officer that's about to or is breaching professional boundaries, and actually on the back of that encourage them to report in when they spot early signs. So that's, in short, part of the next steps, Fiona, of the ambition of the bigger plan here.
No, that's really helpful, Chair. Thank you, Katrina. Thanks for that, because I understand the complexities, the sensitivities and the nature of shifting sands. So very much welcome your approach. Thank you.
Thank you very much for that. Maggie, would you like to come in?
Yeah, for me, Chair, it's just to make Fiona aware that the HMI is keen to have a bit of an assurance review of vetting at the current time, following on from the HMI CFRS report, and we've had meetings with CAT about that. So it's likely we have a meeting with the lead inspector of that report tomorrow to discuss methodologies. It's likely that will take, we're not going to wait until our complaints and handling our complaints review next year. We're going to do that within this inspecting period, and probably hand in glove with the organisational culture inspection that is underway now. So it's just to give you a bit of an assurance that the HMI is keen to do an assurance review of vetting, and that will be taking place next.
Thank you very much, Maggie. That is certainly very, very welcome. So thank you for highlighting that. Grant.
Thanks, Chair. Like my colleagues, Kat, I very much welcome this report and the direction of travel with this. So my question is really, when could we expect to hear further from you or your colleagues as to how the actions that the priority themes that you put in place and so on, how are we going to get a follow-up report in, say, 6 months or whatever?
I think we're all alive to the benefits of reporting in regularly to the board, to be honest about this, given the sort of priority and the public interest round about it. So a report and a progress update round about the 6 month mark is entirely achievable, and I think that will give us something to work to. We should be seeing the fruits of the preventions programme by then. We should have rolled out in some further directions in terms of broadening out the scope of the work as well.
Thank you. That's just ideal. Thank you.
Excellent. Thank you. No, this would have been my suggestion as well, just to make sure we capture it as an action, that there is a follow-up, you know, particularly, I think, against, Kat, what you were saying around your work, comparing, looking at the 2 recent reports which have been produced and seeing how applicable they are and what, you know, what needs to, if there's any learnings, what does it mean for us, and, you know, how do we get assurance that actually some of the themes identified in those reports are not an issue for us, or etc. So no, that makes perfect sense. Fabulous. Thank you. Are there any other questions, observations on the item? Nope. Thank you so much for that. Which means that we are moving on to agenda item 9.1, and that is the Police Scotland update in relation to the recommendations of the independent review of complaint handling, etc. So Kat, I think that's you as well covering
Yes.
this paper.
Yeah, thank you, Chair. So just a summary of the position for us as it stands. Of our 24 recommendations, 20 have now been formally discharged. 2 have been proposed for closure by the Practitioners Working Group, and they'll be presented at the Strategic Oversight Group tomorrow. That will leave us with 4 outstanding recommendations which are scheduled for completion by January 2023. 3 of those relate to data collection that I already referred to, that had been highlighted in terms of systems upgrades that's required in-house at PSD, and 1 relates to a review of supervisory ratios. We also have a footprint in 10 partner-led recommendations. 6 of those are complete and 4 are ongoing, and we're actively participating in those as well, Chair.
Thank you. Thank you for the update. Are there any questions? No, thank you. I mean, monumental effort, I think, that went into getting everybody to the stage. So and not long to go until hopefully the remaining 4 are closed off as well. So here's fingers crossed, and thank you for all the hard work that no doubt went into this. Excellent. Okay, so which leaves us with I believe, the work plan, agenda item 10, the work plan, as the final point in this public session of the committee. And I think this is presented to us for noting. I don't think there is anything else that we need to do on this. I appreciate that, again, one of the actions which was proposed for closing related to the work plan, and understand the work plan now will be circulated by Colette, our governance support officer, just when the action logs are being issued. So it's up to the action owners, I believe, to really make sure that there's realistic dates, and that if they feel that the work plan needs to be amended based on the actions, and there's any additional items that are coming, that the work plan is updated. Did I get that right, Colette? Is that the main message around this particular item of business? Okay, very good. Any questions, comments, observations on the work plan? No? Okay, great. Well, thank you, everybody. This concludes the